The mental health crisis in America has tragically become a lucrative opportunity for corporations like Acadia Healthcare. As demand for mental health services surged, especially in the wake of the COVID-19 pandemic, Acadia, one of the nation's largest providers of behavioral health services, saw its revenue soar. The company operates a sprawling network of facilities across the country, generating billions of dollars in annual revenue. However, behind this facade of success lies a disturbing truth. Acadia's pursuit of profit appears to have come at the expense of vulnerable patients trapped within its system. Founded in 2005, Acadia Healthcare embarked on an aggressive expansion strategy, capitalizing on the growing need for mental health services. The company acquired numerous facilities, rapidly increasing its reach and market share. This expansion coincided with a period of significant growth in the behavioral health sector, driven by factors such as the opioid epidemic and rising rates of depression and anxiety. However, as Acadia's profits swelled, so too did allegations of unethical and potentially illegal practices. Whistleblowers, former employees and patients have come forward with alarming accounts of a system that prioritizes financial gain over patient well-being. These allegations paint a grim picture of a company more concerned with maximizing revenue than providing quality care. At the heart of the controversy surrounding Acadia Healthcare are accusations that the company systematically holds patients against their will to maximize insurance reimbursements. Former patients and employees have described a pattern of manipulating diagnoses, exaggerating symptoms, and delaying discharges to keep beds filled and profits flowing. These practices, if true, represent a shocking betrayal of trust and a violation of patients' fundamental rights. One former patient, Sarah, recounted her harrowing experience at an Acadia facility in Texas. Admitted for depression, Sarah quickly realized that the facility was reluctant to discharge patients, even those who showed significant improvement. "It felt like a prison," she said. "They kept finding reasons to keep me there, even when I felt ready to go home." Sarah's experience is sadly not unique. Numerous other patients have come forward with similar stories, alleging that they were held against their will despite being medically stable enough for discharge. Adding further weight to these accusations are the testimonies of former employees. Nurses, therapists, and other staff members have described a culture of pressure to prioritize profits over patient care. They allege that administrators encourage them to falsify records, extend stays unnecessarily, and downplay patient concerns. One former nurse, who spoke on condition of anonymity, stated, "I saw firsthand how they were exploiting these vulnerable people. It was all about the money." The allegations against Acadia Healthcare raise serious questions about the role of financial incentives in healthcare. As a for-profit company, Acadia is beholden to its shareholders and obligated to maximize profits. This profit motive, while not inherently wrong, can create perverse incentives when patient care and financial gain come into conflict. Insurance reimbursements play a significant role in Acadia's revenue model. The company receives payments from both private insurers and government programs like Medicare and Medicaid. The longer a patient stays at an Acadia facility, the more revenue the company generates. This creates a clear financial incentive to keep beds filled, even if it means keeping patients hospitalized longer than medically necessary. Critics argue that Acadia's corporate structure and financial incentives have created a system where profits are prioritized over people. They point to the company's high CEO compensation, aggressive acquisition strategy, and focus on shareholder value as evidence that financial considerations trump ethical obligations. The allegations against Acadia serve as a stark reminder of the potential dangers of for-profit healthcare when financial incentives are not carefully balanced with ethical considerations.